time right now to send you the message I sent you yesterday morning, which is let's all take a deep breath, maybe stand up wherever you are and stretch, have a glass of water. I got my water here. Really important for all of us to maintain our health, our calmness, and such as we move forward in this process. When I addressed you last Friday and said that this was a rapidly evolving situation, I'm not sure even I understood how rapidly this would evolve, but we are moving forward through the great teamwork of every single person in our department to make sure that we are meeting the needs of both our staff, the people we serve, and the community we live in. So we're going to go through some information. You'll see if you've got the agenda up what the agenda is. I'm not going to belabor that because I'll go through each piece. All right, so I showed you this slide on Friday, which showed you that we had 137,000 cases across the world with 5,088 deaths. As of a few minutes ago, we're now closing in on 200,000 cases with almost 7,900 deaths. In California, as of last evening, we have went from 198 positive cases, which I reported to you on Friday, to 497 with 11 deaths. I believe we had just 1 or 2 deaths on Friday. We have many more counties with community spread, those that I announced on Friday, as well as now San Joaquin, Stanislaus, Alameda, Santa Cruz, Ventura, City of Long Beach, and San Diego. Of all the confirmed positive cases, 7 are under the age of 17, 300 in the 18 to 64, 160 over 65 plus, and about 11 unknown. I will emphasize to all of you, for those of you who read the media very often, we are 100% certain that when you see the number of positive cases, so I mentioned in California we had 497, when you see that number, you should rest assured that there are many more positive cases in the community that we do not know of. They either didn't ask to be tested, even though they might have been high risk, or they had no knowledge that they might have been exposed and are now positive and may or may not have symptoms. So we do now have our first and second COVID case in Fresno County. We got our first case. Our first case was from the cruise ship. I think we reported that on Friday. Our second case on Saturday came through travel. The county is currently monitoring almost 170 individuals and expect notification of more cases soon, with likely community spread notification to follow. We do anticipate that. Our Board of Supervisors officially voted on the local emergency declaration, which there was a press conference on Sunday about. Once we do have some community spread, we will shift fully into mitigation strategies. Many of the things you've heard over the last few days, first the governor announcing no gatherings over 500, that quickly went to no gatherings over 50, and then 10, and that's through our governor as well as the president. Expect that we could go to shelter in place. So we continue to coordinate as a county with all available resources. That hasn't changed since Friday. Again, no gatherings. We've had bars and pubs closed, casinos, restaurants are still open for takeout and delivery at this time. If we get shelter-in-place orders, you still would be allowed to get groceries and medical, but otherwise significantly limited travel. So you should anticipate that. So what are we doing within our department? Hopefully you know about most of these activities. We've moved primarily to telehealth services for our clients, with the exception of medication injections, medication level monitoring, new starts of psychotropic medications, and crisis services. We are screening staff and visitors and clients at all facilities. Some of these things are just in the beginning stages of becoming smooth running operations. We apologize for some of the delays yesterday in checking into facilities and some miscommunications today. What we were trying to accomplish today was to limit access to the facilities except to 1 or 2 locations and streamline the process for employees to declare that they were not ill. We really, really, really don't want anyone coming to work who's ill. We've made the decision at this time, and I'll tell you all about it, that we're going to move to only essential personnel working from here on out. So many of you, in consultation with your supervisors throughout the rest of the day today, will determine that you can go home and work from home. Our goal is to have every employee, where possible, work from home. We need all of you, and we don't want you to worry about being paid. So we are looking at all kinds of options for how you could support the county's efforts by working from home. We're looking at a warm line resource, which I'll have Susan talk about in a minute. And then I also want to tell you a little bit about some homeless outreach efforts we're leading, but I'll save that for the end. So what does work from home mean? You should have been participating, or our leaders in the community are determining each staff's access at their home to either a county-issued or personal phone or computer. We want to figure out what resources do you have to be able to continue either doing the job you have today, if it's possible for you to do that from home, or what resources do you have to support the county in some other ways that we'll talk about. We're also working to identify contact information for each staff member, including your personal phone numbers and emails, if you would give those to us, should we need to communicate with you and you might not have access to work emails or work phone numbers. We are asking staff, you need to be prepared to work from home each day. We'll need you to check in daily with your supervisor until we've established a work plan. The goal is to have everybody's staff covered either by O1, which means you're working from home, or the AN 511 code, which means we've sent you home and we're still working on a plan for you to work. If you're well at home, you should expect to work. In terms of clinical staff, the types of activities we anticipate having you do are providing therapy through either voice or video calls to our clients, checking in with clients, and possibly covering the warm line. We'll add to this list as we identify additional work that needs to be done to meet the needs of the people we serve. For non-clinical staff, we already have some staff assisting with the county call line. The Public Health Department has a line that is made available to the public to call when they have questions, and we have staff who are manning that line daily right now. There may be just the usual work that you do. If most of your work is done at a computer now, we're going to work really hard to make that work available to you at home so you can continue with that work at home. We know we're typically a few months behind in all of our billing, and so there may be some staff that we teach you how to assist with that process, and we'll see if we can get caught up on some of our billing during this time. And then I have down here other duties as assigned, and basically what that means is we may ask you to do something you've never done before. We'll train you in how to do it, or we may ask you to do something we've never done before, like the warm line. And what I would ask is that you all just bear with us and be flexible and patient as we develop these work plans and communicate to you how we will accomplish that. We will be sending out daily mental health blurbs via email, social media, web pages, and media. I sent some out today. Our public behavioral health department is developing those. We're pushing them out through public health, through behavioral health, and other resources. Community medical centers is using some of our blurbs as well. We will keep you updated regularly. We would ask as you go to work from home that you look at the departmental webpage on our county website to follow or follow your supervisor's direction as we develop additional resources and tools to get our work done. The types of things that we're looking at right now in terms of providing you the resources you need, I mentioned, do you have county or home equipment that could be used? And so we're looking at the capacity that the county has for individuals to VPN, and we're seeing whether the VPN process can be done only through county or also through personal. We're also looking at creating workspaces, we'll call it, via the web outside of the county system, where you might be able to access access the G Drive, some of the other drives that you might do your work on. And then Avatar already has a web portal, and you don't need a county piece of equipment in order to access that. The federal government has given us some waivers that give us some leniency on things like where you are when you're providing services, or what type of equipment you're using, and some of the HIPAA constraints that we've had historically have been waived during this crisis situation to enable us to be able to provide services to our clients. I mentioned calls to check in. We may institute a new practice of calling our clients regularly throughout the week to ensure that they're okay, to see what they need, and to try and support them in any way that we can. I think I'm going to have Susan come and just talk to you about what we're looking to do with the warm line.
Well, here I come. Thank you all. Hello. As Dewan mentioned, we are in the early stages of planning to implement a warm line. And what you can think of this warm line as a public-facing phone number, a separate phone number, where individuals in our community could call when they are needing emotional support related to dealing with COVID-19. What we're envisioning right now is that other call centers could push to the warm line. So for example, and this is all in early planning stages, so let me just say that this is an evolving idea. We have a call with Maine IT later this afternoon. But if you can imagine that central call center that public health has right now, they're giving out information specific to the disease and symptomology, et cetera. If they find someone on the phone who needs emotional support, once we have our warm line lifted up, they could push those calls to us. What we're envisioning is that folks could be answering those calls from their home, and we would have a variety of resources for those of you who are answering those calls to utilize, whether that's deep breathing exercises, information on stress management, activities that people could do at home with their kids when they're away from school, how to talk to your kids about COVID-19, et cetera. So as Dewan and I are describing, everything is rapidly evolving, and we appreciate the patience in that. For those of you who might have ideas about that, please do push those ideas to me directly, Susan Holt, and I'll be happy to incorporate what we can. So that's the plan for now. Stay tuned for more information, and we look forward to everyone supporting this warm line.
All right, I want to give you a very quick rundown of what our homeless outreach efforts are. We have taken the lead as a department in addressing the needs of our homeless in this crisis. We've identified a number of properties and locations to shelter or house homeless. We have done some canvassing and surveying to determine the needs, both in terms of prioritizing those most at risk, over 65, chronic health conditions, as well as their willingness to be sheltered. Initially, we will be identifying based on if individuals are cohabitating now, say there's several people in a tent, we will find a location for those several individuals. And then if there's multiple people who are living together in a homeless area, we will attempt to keep them together. We're focusing on having resources for their pets as well as their stuff, we'll call it. We know from talking to our homeless community members that if they can't take their pet or they don't have a place to store their things, they're less likely to accept shelter. So that's been a priority for us, to find locations both where we can have smaller areas for people to live, not a large congregate housing, as well as a place for them to have pets and their things. We have 2 properties that are already furnished, and then another property where we're going to be using some cots that our disaster planning has. We expect to begin moving individuals into that shelter in the next day or 2. It could happen as early as this afternoon. That's the goal. And then we're creating strategies that are phased as we get that first wave of people sheltered. Right now, based on our surveying and canvassing out amongst the homeless, we believe that the resources we have now will accommodate that group. And then we'll go out again and we'll see where people are at, and if they're willing to be sheltered, we have some other strategies, other properties that we could equip at that point, or we'll begin equipping, anticipating that. And then for those who simply refuse to be sheltered, we have plans for how we will support them in place, we'll call. And so lots of activities where I want to emphasize that we're also supporting existing shelters. There are shelters that were created with some funding from the government over the last several months. And so those are individual shelter leadership is involved in these conversations, as well as the Marjorie Mason Center and the Evangel Home. I will say that they're finding, particularly with Marjorie Mason Center, that as the anxiety and stress of this crisis occurs, we are seeing more domestic violence. So we are working to provide shelter for individuals who are victims of domestic violence. Lots and lots of activities going on. We're all very, very busy, and we really, really cannot do this without all of you. I will tell you, in the time of this tremendous crisis, I have been so impressed with the work of every single person on our team. You have a leadership team who is not only passionate about what they do each and every day, but their passion for our community, and more importantly, for all of you, is tremendous. I am so proud to work with each and every one of you. Thank you. You might have questions. I will compose myself while you get your questions put together. I am putting up a slide right now, or we'll put up this next slide that's just a reminder of what you need to do to protect your health and the health of those around you. It's super important as we go into a mitigation phase soon that you all follow the rules and get everybody you know to follow the rules, and those naysayers on social media, I see them every day, that say this is no big deal, are wrong, and we need to convince them. Any questions yet? We are open for questions.
All right, we're muted. I have no questions so far.
Okay.
How about you on YouTube? Oh, okay. How soon are we expected to work from home?
Am I unmuted? Okay. There was a question, how soon are we expected to work from home? So by the end of the day, you'll be notified whether or not you're going to be working from home. So it's quite possible for most of you that you will start your day tomorrow at home. And as I mentioned, for some of you, you may already be aware of how you would work from home. You either have a county-issued laptop, and some of you are actually already working from home. But for those of you who are not, there may be a period of time where we just ask you to stand by and be prepared to work, but your supervisor will be communicating with you a very specific work plan once we understand both in terms of the resources available to you and what we've been able to put in place for you to utilize to assist you in doing your work, what work you will do.
We had one about how do we do timesheets if we can't use the VPN, which the answer is if they have the multi-factor access where they can where you can log into Office from outside work. There's now on the county website an employee portal where you can do your timesheets from home.
Okay. There was a question about how will you do your timesheets. For each of the things that are going to assist you from working from home, so one would be how you would do your timesheet. Another one might be how would you access VPN through VPN, or how would you access via Avatar's portal. We're going to create very specific instructions, and those will be pushed out to each of you. And that each instruction sheet will tell you, in order to complete your timesheet, here's exactly what you need to do. And so you should rest assured, don't worry about now. Don't worry about the next few days. As we go through this process, you'll be getting everything you need in order to do your job.
Is staff going to get printed versions of any of this information?
I must have had prescience to be able to know this question. This question was, will staff get printed versions? Yes, you will get printed. Well, I'm not sure they'll be printed, but you will get written versions of all of these instructions.
How do we know which job titles are considered essential?
The question was, how do we know which job titles are considered essential? This really isn't about job titles. This is about the work that we're able to do from here versus the work that we're able to do from home. So if you are told you'll be working from home, please do not consider yourself a non-essential person. It simply means that you have a job where you could do your work from home. And those of us who will remain working need to be on site in order to do work that the department needs to do. So for instance, because there's still going to be a small number of individuals that we have to see in order to provide services to, those staff will be on site. Myself, as the lead of this department, will likely be on site so that I can do communications like this. But there's other staff that do vitally important and essential work but can do that from home. So I really want to emphasize, if you'll hear the term essential and non-essential. That's a governmental term, and so you might hear, if we decide to shelter in place, that only essential staff, people doing essential jobs will be allowed to travel roads or something. And so that's where that terminology comes from.
What is the recommendation for supervision or weekly mentorship for interns? Are we permitted to do that over video?
Okay. There's a question about if you are an intern or an associate who's unlicensed and you're currently participating in a supervision activity in order to have supervised hours, will that be allowed to be done over the phone or video? Absolutely. We're getting a lot of waivers from state boards and government, the state and the federal government, which is allowing us to do things very untraditionally, non-traditional ways of getting our work done. And so we want to support you in that supervision, and we'll work on a strategy for how that will get done.
If we've forgotten items or if we're currently on leave, can we come back to the office to pick up our equipment?
Okay. There was a question about what if you get home to do work and you forgot something back here, or you're on leave and you need to come back. We can make arrangements for that. There's no reason to believe that we can't figure out a way to allow staff in and out for brief periods of time, of course following all the guidelines, to acquire items that they need here. That won't be a problem.
How will this information be communicated to our contracted providers?
So there was a question about how this information will be shared with our contracted providers. Since last Friday, I've been communicating regularly with contracted providers. I did send them the video we did last Friday, and the emails that you have been receiving, they are also receiving. They're on a separate email. It's a pretty big listserv for each of you, so we're sending 2 separate emails, but they are receiving all of the same information. Some of our contracted providers we're in closer daily contact with than others. So for instance, our crisis stabilization unit providers, our psychiatric health facility providers, that's a daily contact, sometimes multiple times during the day. And then other providers, I'm answering questions as they send them, but we're pushing out a lot of information to them. So every email you've gotten, they've also gotten.
Where can we find the locations of these homeless shelters?
The question was, where can we find the locations of these homeless shelters? If you can tell me what, I'm going to tell you where they're at, but it would be useful if you need to know where they're at for a particular reason if you let us know. One of the locations is the old Comprehensive Addiction Program site. That site was utilized as a warming shelter, and they were successful in getting almost 100 people to that site. So for that site, for example, what we're doing is there are some rooms in that site that are open to other rooms, so we're creating artificial barriers between those rooms. And then, as I mentioned, we're identifying for each room what is the capacity. One of the nice things about Comprehensive Addiction Center is it's already furnished and it's already been run as a shelter. And so there'll be every effort to shelter people in a way that we won't get additional spread simply because they're all in the same room, for instance. So a lot of thought and concern is going into how we structure how each of these are utilized. And as I mentioned previously, the goal would be to identify individuals who already are living together, we'll say, in a way that whatever spread has occurred amongst them has already spread, and then we'll simply locate them together to a place. The other homeless shelter will be at 1040 Pleasant, and that is an existing furnished property as well. Same thing happening there. Look at each room, figure out how to do it. We're also bringing hand washing stations in to all of our areas where we either have shelters or homeless people so that they can wash their hands frequently. We're also looking to bring shelters in, along with what I mentioned, fencing to create pet kennels, as well as some C-train type storage containers to store their items. And then the final location is the property Hacienda. There are 40 large studio apartments there that were developed in anticipation of future need that are not currently being utilized. That's the property that is not furnished, and so that's where we're putting the cots.
You need to mention that these are currently not drop-in shelters.
Okay. There was a question raised, and so I'm going to clarify that currently the sites being utilized for new relocation of homeless individuals are not being used for shelters. I mentioned the CAP site. It was a warming shelter in the past, but that was disbanded about a month ago or so. So these are sites that have capacity today that are not being used at shelters that will be new shelters. We have the existing shelters that are funded through the government. One of those is at Hacienda, but it's in a separate part of Hacienda. And some of those shelters have capacity, but we're going to carefully prioritize filling those shelters.
Are FSPs still having direct contact with our clients?
There was a question about FSPs having direct contact with clients. The guidance that we've given our county-run programs is the same guidance we've provided to our contracted partners, including things like the signage you've seen and the scripts being utilized, and that is that wherever possible, they should conduct telephone visits or video visits, and for them to identify for each program what are critical services that have to be provided in person, and then we've given them the screening tool, the same one we're using as individuals enter our facilities to make sure people aren't sick. If people are sick, we're telling them to manage their symptoms at home. If someone came in and was very, very ill, of course we would call 911 and get them to the hospital. But we're giving the same advice to our contracted providers. So if someone's in an FSP and their services can be provided via the phone, that's how they'll be provided. If something needs to be provided in person, we're asking that that be limited to critical or crisis services and that all precautions are followed.
With teams that normally count travel towards productivity, will there be flexibility with productivity standards during this time?
There was a question about teams that travel and whether or not, and travel is typically included in productivity. If you travel, my hope would be that we'll give you work that keeps you busy, but more importantly, no, productivity is not going to be considered right now. This just is not the time for that type of measure to be used.
With timesheets due this week, if we're sent home right now and have no way to get to timesheets, what do we do?
There was a question raised that if today is your last day coming into work and timesheets are due this week, how would that task be accomplished? And what I would tell you is we will have your supervisors working diligently to properly code your time for the rest of the week so that you get paid properly.
Is the direction that no meetings in person are allowed other than Skype? And they said because normally purchasing prefers RFP evals in person.
Yeah. This question was, are no meetings allowed in person? Is it only by Skype? Because typically something like an RFP meeting, purchasing requires in-person meetings. Most of those requirements and restrictions have been lifted. I would say pretty much all of them have been lifted. So for instance, we've been given guidance that the typical public meetings, like a board meeting and such, can be done via Skype or by phone. That typically is not allowed the way that it is being allowed now. And so as this progresses, I think this will become more and more clear to people. This is unprecedented, and some of the rules simply will not apply during this time. And so if we have to do an RFP eval over the next several weeks and that can't be deferred, it will be done either via the phone or it won't get done.
Would you be using us for volunteer purposes if we choose to help in some way?
Okay. The question was, can you be used for volunteer purposes if you choose to help in some way? We've talked about a lot of different needs that the county has and activities that we're trying to support. So if you've heard of something like helping to man the public health phone line or that type of thing, please let us know. I will let you know that based on the needs of the department, you may be asked to do something else, but we do appreciate that people want to volunteer and help support our efforts, and so I want to acknowledge that and thank you.
Do you know if Exodus will be operating?
There was a question whether Exodus would be operating. It is our expectation that all of our crisis services will remain open. Of course, this is an evolving situation. They are doing everything they can right now to ensure that the people that they're serving and their staff are safe. They're doing the same type of screenings we're doing as people come in. We're trying to ensure that individuals that don't need to go to an emergency department first don't, because we know we don't want our emergency departments to be overrun. And so we're trying to ensure that Exodus remains there to help meet the needs of individuals who might be in mental health crisis. And we will do everything we possibly can to ensure that it stays open. I'm going to give it another 10 or 15 seconds to see if any more questions come in. But again, I do want to thank all of you. I know this is a very anxiety-producing time. And really, as I've said in many different venues and settings, it's important for you to rely on factual information from trusted sources. We hope to be one of those for you. If you're concerned about COVID, going to the public health website is a great place to get lots of different factual information. We will continue to push out to you guys in any way, shape, or form we can. Information on how to maintain our own mental health and help you when you're talking to kids and when you're talking to loved ones. I highly encourage those of you who do participate in social media to like and join our Facebook page. That's either that Facebook page or the Fresno Cares Facebook page is a way that we're sharing that information. As we get through this crisis, we're hoping to create messages, and we plan to create messages in our other threshold languages, both Hmong and Spanish, so that all of the members of our community have their needs met.
For those of us working from home, what are instructions we should provide in the event of a psychiatric emergency, since hospitals are trying to restrict the amount of people in facilities?
There was a question about if you're working from home and you're interacting with a client and they appear to be in a psychiatric emergency. A couple things I would tell you. One is we're going to give you very detailed instructions for what to do in a number of scenarios. But you should always feel comfortable calling 911 for that individual. If someone's in a psychiatric emergency, that is a crisis, and 911, when they respond, can ascertain where the best place for that person is to be.
Are there shelters that are better than others for pregnant women?
There was a question of whether or not there are shelters better for pregnant women than others. If you know of a particular homeless individual who is pregnant and you let us know, we'll reach out through the efforts that we're leading to identify the best location for them. As I mentioned previously, we really are right now trying to house people in individual living settings, and so that would be a priority.
Should our wellness centers, Blue Sky and YECs, be shutting down?
There was a question about whether our wellness centers, Blue Sky and YECs, shut down, and I believe they have already done so.
Do we know about CBHC?
There was a question about CBHC. It is open and up running for business. The hospitals, I anticipate, will remain open. If they begin to get COVID cases, confirmed cases in any congregate type living or residential facility, we'll have to handle it on a case-by-case basis. Remember, the majority of individuals who develop COVID will have a mild to moderate response and course of illness, but just like we would do with anyone, we would try and isolate them to prevent spread to other people. And use personal protective equipment once we know someone's positive. So I want to thank you once again for tuning in. We will make this recording available. Today's recording was done via WebEx as well as on YouTube, so hopefully it will be a little quicker for the YouTube posting. Those are the postings that I'm sending out to our contracted providers as well. Future presentations they will be invited to, and they can participate as well. So I do want to assure you that we are reaching out across our community of providers, and we will continue to do so. Thank you very much.